Heartburn. It's a name many of us know, but what exactly is it? Despite its name, heartburn has absolutely nothing to do with your heart. Instead, it is a burning pain or discomfort in your chest, just behind your breastbone. This sensation often feels like it is rising up from your stomach towards your throat, and it can leave a sour or bitter taste in your mouth. Many people describe it as a fiery feeling that can range from mildly annoying to quite severe. The feeling can last for just a few minutes, or it might linger for several hours, making it hard to relax or even sleep properly. The underlying cause of this uncomfortable feeling is something called acid reflux. Inside your stomach, you have powerful acids that help to break down the food you eat. Normally, a muscular ring at the bottom of your esophagus, the tube that carries food from your mouth to your stomach, keeps this acid where it belongs. This valve is called the lower esophageal sphincter, or LES. It acts like a one-way door, letting food in but stopping stomach acid from splashing back up. When this valve weakens or relaxes at the wrong time, acid can escape and flow backwards into the esophagus, which is not designed to handle it. This process of acid flowing back is what we call acid reflux. The delicate lining of your esophagus is not built to withstand the strong acid from your stomach. When the acid comes into contact with this sensitive tissue, it causes irritation and inflammation, leading to that characteristic burning pain we call heartburn. It is a bit like getting lemon juice on a small cut. The acid stings and causes discomfort. It's a simple mechanical problem, really, but one that can have a significant impact on your day-to-day comfort and well-being if it happens frequently. You might be surprised to learn just how common heartburn is. It is not a rare condition that affects only a few. In fact, studies suggest that more than 60 million people in the United States alone experience heartburn at least once a month. Some estimates indicate that up to 15 million Americans feel its effects every single day. This makes it one of the most frequent digestive complaints. It can affect people of all ages, from young adults to the elderly, and is particularly common during pregnancy due to hormonal changes and increased pressure on the stomach. The most obvious symptom of heartburn is, of course, that burning feeling in the chest. This pain often worsens after eating, particularly after a large meal. It can also become more intense when you are lying down or bending over, as these positions make it easier for stomach acid to travel up into the esophagus. Alongside the burning, you might experience a sour or acidic taste at the back of your throat, a condition known as regurgitation. Some people also report difficulty swallowing, a feeling that food is stuck in their chest, or even a persistent cough or a hoarse voice from the acid irritating the throat. Certain foods are well known for triggering heartburn because they can either relax the lower esophageal sphincter or increase the amount of acid your stomach produces. Spicy foods, for instance, containing ingredients like chili or curry powder, are common culprits. Fatty and fried foods, such as chips or burgers, take longer to digest and can put more pressure on your stomach. Other frequent offenders include citrus fruits like oranges and lemons, tomatoes and tomato-based products like pasta sauce, chocolate, peppermint, and caffeinated drinks such as coffee and cola. Onions and garlic can also be problematic for many individuals. It's not just what you eat, but also how you live your life that can contribute to heartburn. Certain activities and lifestyle habits can significantly increase your risk. For example, eating large meals fills your stomach and puts more pressure on that all-important valve, the LES. Eating too quickly or not chewing your food thoroughly can have a similar effect. Lying down right after a meal is another major trigger, which is why late-night snacking can often lead to a painful night. Being overweight or obese adds extra pressure on your abdomen and stomach, pushing acid upwards. Smoking is also a known factor, as it can weaken the LES. Understanding your personal triggers is a crucial first step toward managing your heartburn effectively. It can be very helpful to keep a simple food and symptom diary for a week or two. In this diary, you can jot down everything you eat and drink, as well as the times you eat. You should also note when you experience heartburn and how severe it feels. This simple exercise can help you identify specific patterns and pinpoint the exact foods or habits that are causing you the most trouble, allowing you to make targeted changes to your diet and daily routine for better relief. When you visit your doctor about persistent heartburn, the diagnosis often begins with a simple conversation about your symptoms and lifestyle. Your doctor will want to know how often you experience the burning sensation, what it feels like, and if certain foods or activities make it worse. In many cases, this description is enough for a doctor to diagnose simple acid reflux. If your symptoms are frequent and disruptive, occurring more than twice a week, your doctor might suspect a more chronic condition known as Gastroesophageal Reflux Disease, or GERD. This is essentially a more severe and long-lasting form of acid reflux that can lead to more serious complications if left untreated. If your symptoms are severe or don't improve with initial treatments, your doctor may recommend further tests to get a clearer picture of what is happening inside your esophagus and stomach. One common procedure is an upper endoscopy. During this test, a doctor guides a thin, flexible tube with a tiny camera on the end, called an endoscope, down your throat. This allows them to look directly at the lining of your esophagus, stomach, and the top part of your small intestine. They can check for any inflammation, ulcers, or other damage caused by the stomach acid. Another useful diagnostic tool is an ambulatory acid, or pH, probe test. This is considered the gold standard for measuring acid reflux. For this test, a very thin monitor is placed in your esophagus, either clipped to the lining during an endoscopy or passed through your nose. This monitor stays in place for 24 to 48 hours and measures when stomach acid splashes up into your esophagus and for how long. You would continue with your normal daily routine, including eating and sleeping, while the device records the acid levels, providing a detailed report of your reflux patterns. In some situations, your doctor might also order an esophageal manometry test. This test is designed to measure the rhythmic muscle contractions in your esophagus when you swallow. It also measures the force and coordination of the muscles, including the strength of the lower esophageal sphincter, or LES. This can help determine if the problem is related to how the muscles in your esophagus are functioning. By using these diagnostic tools, doctors can distinguish heartburn from other conditions with similar symptoms and create a treatment plan that is tailored specifically to your needs. Fortunately for many people, managing heartburn can be achieved through simple yet effective lifestyle changes. One of the most important steps is to adjust your eating habits. Instead of eating 2 or 3 large meals a day, try having smaller, more frequent meals. This prevents your stomach from becoming too full and putting pressure on the LES valve. It is also wise to avoid eating for at least 2 to 3 hours before you lie down for bed. This gives your stomach ample time to empty, reducing the risk of acid reflux while you sleep. Elevating the head of your bed by about 15 to 20 centimeters can also use gravity to help keep stomach acid down. Making smart choices about what you eat and drink is also fundamental. By identifying and avoiding your personal trigger foods, whether they are spicy dishes, fatty meals, chocolate, or coffee, you can significantly reduce the frequency of your heartburn episodes. Maintaining a healthy weight is another powerful strategy. Losing even a small amount of excess weight can relieve the pressure on your abdomen and stomach, which in turn can lessen the pressure on the LES. Quitting smoking is also highly recommended, as nicotine is known to relax the LES, making it easier for acid to escape. When lifestyle changes are not quite enough, there are many over-the-counter medicines that can provide fast relief. Antacids, such as Tums or Rolaids, work by neutralizing stomach acid and are great for occasional mild heartburn. Another group of OTC medicines are H2 blockers, such as famotidine or Pepcid AC. These work by reducing the amount of acid your stomach produces. For more frequent or severe heartburn, proton pump inhibitors, or PPIs, like omeprazole, Prilosec OTC, and esomeprazole, Nexium 24-hour, are very effective. They provide longer-lasting relief by blocking acid production more powerfully. Ultimately, managing heartburn is about taking a proactive and consistent approach to your health. By combining sensible lifestyle adjustments with the appropriate use of medications when needed, you can gain control over your symptoms. It's about creating a routine that supports your digestive health, from eating mindfully to maintaining a healthy weight. If your symptoms persist despite these efforts, it is always important to speak with your doctor. They can ensure there isn't a more serious underlying issue and help you find the most effective long-term solution, allowing you to live comfortably and free from that burning sensation.